Let's see about COPD. COPD is chronic obstructive pulmonary disease. So in this lecture we are discussing about what is a chronic obstructive pulmonary disease, that is COPD, what causes COPD and symptoms of COPD, and how is chronic obstructive pulmonary disease is diagnosed, and management and treatment. Hi, this is Dr. Pavitra from Dr. Smile Fresher YouTube channel. Please subscribe our channel for more lecture videos. Let's start. What is chronic obstructive pulmonary disease? So it is a term for certain types of irreversible lung and airway damage that obstruct the airways and make it hard to breathe. There is two types of COPD. One is emphysema and chronic bronchitis. We will discuss about that later. There is a lot of changes in the lungs and airway in COPD. Let's see. There is loss of elasticity in the airway and air sacs of the lungs. And inflammation, scarring and narrowing of airways and thick mucus in the airway and destruction of the wall between the alveoli. This enlarges them and traps the air. Next, moving on to types of chronic obstructive pulmonary disease. COPD include both emphysema and chronic bronchitis. In emphysema, when the alveoli become damaged and enlarged, the most common symptom in emphysema is shortness of breath, that is dyspnea. And in chronic bronchitis, there is inflammation in the large airways. This narrow your airway and make lots of mucus. So cough is the most common symptom. So in this slide we have to note two important points. One is emphysema, the symptom is shortness of breath, dyspnea, and in chronic bronchitis there is a cough. These 2 points are important. Next, what causes COPD? Damage the lungs from smoking is the most common cause of COPD. So smoking is very important cause in COPD. Other causes are alpha-1 antitrypsin deficiency. It is a genetic disorder that can lead to lung damage. And the second is second-hand smoking and air pollution and exposure to dust and fumes from your jobs and hobbies. So here the most important cause is smoking. Next, what are the symptoms of COPD? There is cough with sputum, especially in the case of chronic bronchitis. There is presence of cough and sputum on the most days for at least 3 consecutive months for more than 2 successive years. It is very important. In chronic bronchitis, there is a presence of cough and along with the sputum at least 3 consecutive months for more than 2 successive years. And the next symptom is difficulty in taking a deep breath and shortness of breath, especially when performing daily activities or with mild exertion, and wheezing and other lung sounds, and barrel shaped chest. I will tell you the symptoms in chronic bronchitis and emphysema separately. Let's see. In emphysema, there is a barrel shaped chest. Barrel shaped chest means increased AP diameter, loss of cardiac and liver dullness, and diminished vesicular breath sound. So the use of accessory respiratory muscles, breathing with pursed lips, and lack of cyanosis is characterized by emphysema. This is known as pink buffers. So here the important point is a pink buffers in emphysema is very important. Pink buffers in emphysema characterized by breathing with pursed lips and lack of cyanosis. In emphysema there is no cyanosis, and in emphysema there is barrel shaped chest. It is very important. Let's see the symptoms in chronic bronchitis. There is presence of cyanosis, blue color. So there is presence of cyanosis, and right heart failure are more common and seen earlier in the course of disease in patients with predominant in chronic bronchitis. So chronic bronchitis, blue bloaters. So pink buffers in emphysema, blue bloaters in chronic bronchitis. In chronic bronchitis, there is presence of cyanosis and right heart failure. This is the important point. Next, what are the complications of COPD? There is presence of bacteria. A COPD can trap bacteria in your lungs. This leads to infections. These infections can prevent oxygen from getting into your body and carbon dioxide from getting out. So this can lead to serious complication. What are the complications? Pneumonia and high level of carbon dioxide in the blood, that is known as hypercapnia, because carbon dioxide can't getting out, so they are stuck in the blood. So there is high level of carbon dioxide is known as hypercapnia, and oxygen can't enter into the blood. So low levels of oxygen in the blood, that is hypoxemia. And other complications are respiratory failure, pulmonary hypertension, and right-sided heart failure, that is cor-pulmonale, and collapsed lung, pneumothorax, and polycythemia, making too many red blood cells. These are the complications of COPD. Next, investigations of pulmonary function test. Spirometric demonstration of airway obstruction without significant reversal is the hallmark of the diagnosis of COPD. So significant reversibility of the obstruction is defined as 15% or more increase in FEV1 after 2 puff of beta adrenergic agonist. So FEV1 by VC ratio of less than 70% strongly suggest COPD. Next is pulse oximetry, an imaging test. Chest X-ray or CT scan can look for lung changes caused by COPD. An arterial blood gas test. This is a blood test that checks oxygen and carbon dioxide levels. And exercise testing. This is to determine if the oxygen level in your blood drops when you exercise. Electrocardiogram, ECG or EKG. So this test to checks heart function and rules out heart disease as a cause of shortness of breath. Blood test. Your provider may check your levels of the protein AAT to see if you might have alpha-1 antitrypsin deficiency. So this is the one of the cause for COPD na. So we have to check. And the next one is genetic testing. If your provider thinks a genetic condition could be causing your lung issue, they may check for genetic changes with blood test. Let's see treatment for COPD. If it is in the mild case, you have to stop smoking, and vaccinations for influenza and pneumococcus and shock-acting beta agonist. If you are in a moderate stage, all of the above plus long-acting bronchodilator, pulmonary rehabilitation, consider macrolide if frequent exacerbations. If it is a severe case, all of the above plus combination inhaled corticosteroid if repeated exacerbation, oxygen if needed, consider PDE4 inhibitors, and if it is a very severe case, all of the above plus consider surgical treatment. This is all about the treatment of COPD. Let's see some important points in chronic obstructive pulmonary disease. It has two types. One is chronic bronchitis, another one is emphysema. In chronic bronchitis, there is a cough with the sputum, and in emphysema there is dyspnea. It is very, very important. You have to remember the cause for COPD. The main cause is cigarette smoking, and the symptoms you have to remember in emphysema and also in chronic bronchitis. In emphysema there is pink puffers and presence of barrel shaped chest. In chronic bronchitis there is blue bloaters, presence of cyanosis and right heart failure. Here the important point, the cyanosis only present in chronic bronchitis. It is not present in emphysema. It is very, very important. This is all about COPD. Thank you for watching this video. Please subscribe Dr. Smile Fresher YouTube channel for more lectures.